Okay, welcome back to the Thrive with Lyme Summit. Today I am here with Dr. Bradley Campbell, who is up from Chicago, right? Chicago
hmm
neighborhood.
Yep.
And I just want to welcome you. My name's Elizabeth Elliott. I'm with Fusion Stretch and Wellness in Louisville, Kentucky, and I'm excited to bring to you the secrets of achieving and healing Lyme through mind, body, and spirit. Super excited to have you today.
Thanks for having me on, Elizabeth.
Yeah. I've been following you since COVID and I've really enjoyed all of your messages. They've been great. Definitely resonated with me more days, you know. So Dr. Campbell runs a natural health clinic just north of Chicago, Illinois. He was born and raised in the suburbs of Chicago and majored in saxophone performance at Illinois Wesleyan University. He received his doctor of chiropractic degree from National University of Health Sciences and is completing 10 postgraduate degrees in natural health care. Aside from playing music, he enjoys reading, cooking, and spending time with family, friends, and his Irish setter, Albus. And he is setter, right?
hmm
Albus. He's pictured on the flyer that you all saw.
hmm
So, welcome. Um, I wanted to ask you, like from the get-go, this music to chiropractic, how did that happen?
Well, I always had a love for both. Um, I had a terrible concussion when I was 9 years old, where a chiropractor saved my life after 20 plus conventional doctors couldn't figure out what was going wrong or how to help. But my grandpa was a saxophonist, and he was a professor at Illinois State University and ran some of the high school bands in central Illinois. And so he was like playing with the Count Basie band and was just super into music and rewrote scripts for all of his people. And we listened to a lot of music, and my parents played music growing up and sang and stuff like that at holidays. And so I was exposed to the beauty of music from an early age. And eventually, when it came time in middle school to learn an instrument, I, of course, picked the saxophone like my grandpa and just fell in love with it. Started like learning it even before school started, and took lessons since I was a little kid, and it became sort of my identity through high school. And then I decided to do both pre-med and saxophone performance in college. And I just loved music. I was in like marching band and jazz band and concert band, and I learned to play flute and played in the orchestra and just did a whole bunch of jazz and classical saxophone. And I was thinking that I was going to be a music professor. So I thought I was going to go to be a saxophone professor. And I grew up in a fairly wealthy town north of Chicago, and I just didn't really love the wealth that was in that town. It's one of the top three wealthiest old money type towns in the country. And I was like, I don't want to make money. I don't want to be a doctor. That sounds cool. Like a chiropractor saved my life. But I wanted to help more people than just sitting in a practice room playing music all day and then putting on a recital once a year that only like 10 or 25 people showed up to. I wanted to do more hands-on work. I wanted to help more people than what I could do with music or even music therapy, which I had considered. So I kind of, and I also realized that as much as I loved playing music, teaching music one-on-one, I was not as excited about. It was very slow. It wasn't really a lot of instant gratification. And I saw the chiropractor who helped me as a kid get tons of instant gratification for myself and others. So I think that was more appealing too. Like I would injure my thumb and I was going to need thumb surgery because I was carrying my instrument wrong, putting pressure on it the wrong way while I was in marching band. Excuse me. And so what happened was I thought I was going to need surgery, went to the chiropractor, and instantly in one visit, the thumb pain went away. So I was like, wow, that's really cool. Like I can teach people music lessons, but it takes them months to get better. And then my chiropractor got me better just one visit. And then a few months later, I studied abroad in Ireland and got to conduct an orchestra there and play a lot of saxophone and teach some saxophone lessons. And I injured my wrist and got carpal tunnel in my wrist. And again, went to the same chiropractor, and he fixed me in one visit after the other doctors in Ireland said I might need surgery. So I was like, that's really cool. I should probably consider doing that for a career. And so I was debating doing chiropractic or medicine and maybe doing the saxophone professor thing. But, and I was actually closer to becoming a surgeon. Like I really wanted to be an eye surgeon and maybe help people that way. But the medical doctors who I talked to while debating what I want to do with my life, they were all really down on the profession. They were like, it's 8 to 12 years or more. It's really tough. It's a grind. It's very competitive. People aren't really like positive. It's not the healthiest place. And every chiropractor or naturopath I talked to like loved the career, loved the profession. And I almost didn't do it because a lot of chiropractors and acupuncturists and naturopaths don't practice, I believe, in the most ethical of ways, especially chiropractors. They can do like, they almost try to do this thing where it's high volume. They try to see as many people as possible in an hour. So you only get like 1 or 2 minutes or maybe 5 max with those style of chiropractors. And though they get really great instant gratification and pain relief and results and all kinds of things, I liked the way my chiropractor took more time with people who would take 30 to 60 minutes per person. It wasn't as financially rewarding, but it was what was doing what was right for the patient. So he convinced me to go to chiropractic school, and I'm really glad he did. The guy who fixed my carpal tunnel and my thumb injury and my concussion. And so I've never looked back ever since getting into school. I just became like a bookworm, was reading a book a day and taking seminars almost every weekend, and have just loved natural healing ever since.
Oh, I think that sounds great. I know that my daughter had shingles a couple years ago, and the doctors we took her to did not figure it out. I took her to the chiropractor because she was complaining of back pain, and she had a small little rash. It was like the size of a quarter that particular day, and we had been told it was contact dermatitis. And he looked at her and the rash, and he goes and listened to her describe her pain. And he goes, I don't think so. I think this is shingles, you know. And of course, she was 15. So you don't really hear of a lot of 15-year-olds not getting shingles, but she'd had chickenpox as a child and a very, very mild case. And, you know, and anyway, she got shingles. It was brought on by stress. So her dad had left town. And I mean, it just was like almost instantaneous that
Wow.
this kind of popped up. So anyway, well, that's awesome. And I love the holistic health field. I have for a really long time. So I really commend your work. So now, do you see a lot of patients with Lyme? And what brought
I
you, you know, what do you see a lot? And you said something maybe about, you didn't say it, but to me, about your mom having Lyme. Like,
Yeah. So my mom had chronic Lyme among a slew of other things like fibromyalgia. She had some other viruses and things like that. But she was bit by a tick multiple times and had the acute Lyme bullseye rash, and had the Western blot test, the standard test for Lyme, test positive, and some other, I think, IGeneX and some other labs show positive over the years. So I've helped her through Lyme when I was an early stage doctor, and then I took some more functional medicine type trainings in diagnosing Lyme and treating chronic Lyme as well. And I do have at any time a number of Lyme patients. They kind of flux in and out. My style of practice is I run a very primary care practice. So I help some people with chiropractic stuff and like back aches and pains, or I do acupuncture for certain people with like structural health. I do a lot of emotional stress relief stuff. And I also run blood tests on my patients. So I think it helps to describe like what type of practice I have, because it allows people to see my bias or my perspective. But it's truly my office is called Integrated Holistic Healthcare. And it's really integrating as many holistic things as I can, like chiropractic, like functional medicine and naturopathic medicine, like acupuncture, because I went to acupuncture school as well. So it's really, most of my patient visits are at least half an hour long, and they're usually listening for 10 to 20 minutes, then doing some hands-on stress clearing work or chiropractic or acupuncture or like lymphatic massage to really help the person heal, sometimes doing craniosacral therapy as well. So I do see a number of Lyme patients, test for it, treat them for chronic Lyme. But as I told you, I don't see as many acute Lyme patients in the Chicagoland area.
so can you define the acute Lyme versus chronic Lyme and what that looks like for the audience?
Yeah, in general, the acute is just earlier, more immediate, more it's like the first stage of Lyme disease typically, but not everybody with chronic Lyme gets acute Lyme disease, which can be tricky. But a lot of times what they would say is that you get a tick bite or you get exposed to Lyme disease or one of the co-infections, usually from some sort of vector, but you get sick, you catch the germ, so to speak, is the traditional sense. And then you develop oftentimes like a flu-ish type reaction or a feverish type reaction, or but it varies in everybody what that acute Lyme disease looks like, but the classic skin side is a bullseye type rash, which looks like a red bullseye around where the tick was on your body. And so you get an acute early on infection with typically more of an inflammatory response. And then some people believe if it's not treated perfectly, that could turn into chronic Lyme as well. Though some people do not get the bullseye rash, they might get something that looks like a cold or a flu or something else. And then they could, if it's not treated effectively, that could turn into chronic Lyme as well. Or there are some patients who I know who they have really high titers for chronic Lyme disease, but they never remember having a bullseye rash or getting sick, or they just don't know when it started. But the acute is typically like the initial early onset of when someone first got more sick with it.
Okay, so when you say some with chronic Lyme never have had the acute,
well, it's like they either never have had it or they never realize that they've had it too.
Right. And so they potentially are not getting diagnosed right away, right?
Yes.
It's like a lot of people go undiagnosed for years with a whole slew of symptoms that are unexplained, that many doctors can't wrap their head around. And, it's like sticking on a bunch of Band-Aids, but never getting to the root cause.
Yeah, I forgot the statistic, but I think it's like at least over an average of over 10 years, if not 20 years, of being misdiagnosed for most Lyme disease type patients.
So the Western blot test, I know that that one can be fairly inaccurate. What
Yes.
do you recommend? What type of testing do you do with your patients, or would you recommend for those with Lyme or maybe suspected Lyme, or those who are like my doctor, I keep telling them my symptoms, they're not listening, that kind of thing. Like, what would you tell them? How would you tell them to advocate for themselves and ask for what they need? And what are those things?
Yeah. How to advocate is a great question. A lot of it is just realizing that the conventional doctors will not always be allowed to run the tests that they need in order to get a true diagnosis. Some of their hospital systems will literally kick them out of their hospital system or out of their network, or if they were to run certain tests, or they just can't do it. They have to refer out for that. So they might have to go to a functional medicine type practitioner or a naturopathic doctor or someone who is independent. And they could sometimes some doctors will run it though, especially if they own their own clinic. And if they're open-minded, they might be allowed to do that here and there for certain patients. So it's really just coming to them and saying, hey, I heard about this test, and we use either IGeneX or Vibrant America. I mostly use Vibrant America and their tick-borne Zoomer and co-infections test. It's to test for a lot of Lyme disease and the problems it can cause. A different autoimmune testing like an ANA or an ENA panel is really helpful for most people with chronic Lyme disease. And either doing all of the tests they possibly can, like the Western blot test or some of the advanced testing you can do for the co-infections through Quest Diagnosis or LabCorp or the other conventional medicine labs. So you can ask them to run more tests for co-infections or more specific tests. And the doctors should be able to look those up and figure out what they are with a quick Google search. But if you can't do that, you could order some of those tests for yourself. I believe, well, at least through my, sorry, I got confused. Some of them you can't. I think IGeneX you have to get through a physician, and Vibrant America do as well. I have an online membership that's fairly cheap that allows people to order the tests for themselves too, which is usually cheaper than finding a practitioner. But Vibrant America's tick Zoomer or tick-borne testing is typically the one that we value the most because it gives you conventional and sort of alternative ranges. Because a lot of people it's not necessarily so black and white as far as what the testing shows. A lot of people think like, well, do I have Lyme disease or not? Like, well, there's actually multiple forms of tick-borne illness, and it's not always necessarily Lyme exactly, but it's a similar variant that looks like Lyme disease, but isn't the classic Lyme disease form.
Okay. So now if like through your membership and ordering those tests, does somebody have to interpret that? Are those tests returned to you? Are you the ordering doctor?
Yeah. So that's sort of the problem, I guess, is I cannot I currently don't have enough time to give people those results. What we do is we usually refer them to a number of practitioners who they can pay like whoever they choose to interpret the test for them. The lab does, I believe, give like a free consult for people. But that's the tricky part with like online lab ordering for yourself, is how to apply it to you as a person really takes a practitioner to determine what to do about those results. Because you might have positive results, but have no symptoms and you don't really need to do anything. Or you might have positive results with no symptoms and you do need to do something. And you might not be realizing the symptoms that it could be affecting as well. But I usually will refer people not to my membership. I'll usually refer people to a Lyme literate practitioner of some sort.
Okay. Okay. So through your membership, they can still get the test through you, but you would refer them out.
Yep. And most people through ifm.org, the Institute of Functional Medicine, are aware of Lyme and know how to treat it at least fairly well. I'm guessing you probably know there's like some different libraries of Lyme literate doctors as well online where people can look for that too.
Right. Yeah. Now, so what do you find most effective in treating Lyme patients?
Yeah. So if it's acute phase, a lot of times I will refer out for an antibiotic treatment if it's confirmed to be Lyme. But in the chronic phase, there is a debate on whether or not long-term antibiotics are useful or not. My personal clinical experience and the practitioners who I mentored under who were treating Lyme for 30 or 40 years, and some of the Lyme specialists in our areas are not a big fan of using long-term antibiotics for most people. Some people do feel better on it, but I find that typically it's not always because that's keeping the Lyme disease or the co-infections at bay. It's typically because they have a gut imbalance that the antibiotic is keeping at bay. So they have SIBO or some other immune imbalance that the long-term antibiotics are helping them with. And so I'm not one to usually prescribe or recommend long-term antibiotics for people. I usually find that treating the person's underlying deficiencies is the best way to strengthen them so that their immune system can overcome their infectious burden as well. A lot of people think that they just have one bug that's the problem. And people who've been doing this for a long time, there's Lyme, there's its co-infections. A lot of times people have Epstein virus or chronic things there. They might have a yeast overgrowth in their gut. They might have bacterial vaginosis or like there's a lot of medical problems that can happen. So the question is always like, well, where do I start? And when you're sickest, starting with the basics is the most important step. So it's like getting someone sleeping is pretty much like first step, no matter where someone is, whether they have Lyme or they have cancer or they have whatever. It's like you want to start with sleep. You want to start with stress. You want to start with just hydrating and eating well. So if someone's not doing that, that's like start with the basics first and then kind of like extrapolate out to where are those person's overall deficiencies or other health factors that are impacting them.
Now, do you recommend running a food sensitivity test?
Not always.
Okay.
Yeah, it really depends on the person. A lot of times with Lyme, there will be forms of autoimmune disease.
Yeah.
Almost always, I've found that. So running an ANA panel or an ENA panel, or Cyrex Labs has some panels for autoimmune. There's just such a large percentage of people who have chronic infections that have an autoimmune process because that's actually your body trying to clear out the infection naturally. It's like your body is fighting the tissues where the infectious burden is. So avoiding gluten and dairy are almost always going to be beneficial for people. There are some people who have been having raw milk for a long period of time and their body seems to tolerate it well. But for most people, they're oftentimes having an autoimmune response, and because of that, gluten and lactose and casein and whey protein are going to be reactive for almost all my patients. So if I pull them off of that, that's usually more than enough. Like that's overwhelming for the average person. So I won't always run a food sensitivity test because many of these patients also come in already restricting their diet because it's helped them feel better. And so like removing an extra 10, 15 foods is going to be a little bit overwhelming.
Right. Yeah. Yeah, that makes sense. And that can feel stressful in and of itself. They got to deprive themselves of all of these things.
Yep.
Right. And
Yep.
that can feel just discouraging. I mean, it can even cause a little depression and withdrawal once you do remove that stuff.
Yes.
you
Yeah,
know.
definitely. It can create some health anxiety sometimes too. Like there is a downside to food sensitivity tests. That said, I do test people for them fairly regularly, especially if people want to know or if they have an autoimmune issue. It can be very helpful, but I sort of decide based on where someone's food, their mental health regarding their food and their lifestyle is. Some people are like, yeah, I could eliminate 15 things, like no problem. And other people are like, don't take away gluten. So
Right.
depends on their state.
Now, do you find that in your Lyme patients that you see a heavy metal toxicity load?
Um,
I mean, or do you test for that? Or really, I
I
mean, I know
do,
everybody's
yeah.
bio individual. We're all going to be very different.
Mhm. I don't find that often, and I don't often find treating heavy metals to be that necessary unless they're having dental reactions. So if their oral health is really poor and they have mercury fillings, a lot of times I will recommend them remove those and then do testing. I personally had a history of severe lead poisoning from chiropractic and naturopathic school. I was in an 1800s house where it was in the pipes and in the super high in the water, and then I did a chelation test and found lead and mercury in my own body. But I've found that generally, unless someone's being acutely poisoned by heavy metals, it's not as big of an issue as I've been trained. So I was trained that heavy metals are really important and you always have to get them out of somebody to get them better. But I think if someone's not drinking or actively putting a lot of the heavy metals in their body, if the body is working effectively, functioning how it's supposed to, those old heavy metals are kind of just like stored and not causing problems for 90% plus of people. So I don't focus on that as much as I focus on usually some of the Chinese medicine deficiencies of the lung and large intestine and the metal element, oftentimes their hormonal system or their digestive system, strengthening that first and working on their mental health is usually where I get the biggest bang for my buck as far as helping people feel better, faster.
Right. So would that be also including like a mindset shift?
Yes. Yeah, the mindset shift is really, really crucial.
Like an I can heal mindset versus
Yes.
woe is me. I
Yep.
have Lyme. I'm forever having Lyme, right? And I mean,
Yes, I have.
I'm thriving with Lyme, or I'm right,
Right.
or you're
Yeah. Yeah, there are really like you kind of just personified one of the chronic Lyme patients, which is sort of like there's like two types. There's like people who are like, I have chronic Lyme, it's messing my life, I need to do this. And then there's the Lyme patient who's had it for a long period of time, who's run down, who's been to 10 practitioners, who's like, I am chronic Lyme, not I'm recovering from chronic Lyme, or like I am working on getting rid of chronic Lyme. They come in with the story of like, I have this, I am this, I will always be this. This is going to be my lifestyle forever. And they're very run down and tired, reasonably so. But starting to switch the mindset is really helpful. And there are programs that I refer people to, like Dr. Kathleen King has a program, Primal Trust, which is similar to like DNRS and the Gupta method and some of these other methods, which are about like retraining your thinking.
okay.
Sometimes I'll have people just get a book by like Byron Katie or Eckhart Tolle, but a lot of the mindset shift into a more positive thought outlook does help depression and anxiety, even if the Lyme is causing you to be depressed and anxious, which happens all the time for Lyme people.
Right.
You can work towards shifting some of your mindset and working through mindfulness meditation or other sorts of nervous system self-care.
Um, and when you and then other self-care in adding to that, which is not necessarily about mind, but even exercise, right? To me, it seems like it would be challenging if you're down and dumpy and depressed, taking that action step to move the body.
Mhm.
Are there things that you find or even recommend or even more beneficial, right? I mean, obviously to me, we're not going to go out and do CrossFit if we have Lyme. It almost seems counterintuitive to healing, right? So
For sure.
finding something more like, I don't know, Pilates or yoga or even just walking
Yeah.
or even
Depends how.
hiking. That might be scary. They might not want to go outside. I hate to say hiking.
Right.
I find it very healing, but my daughter was like, I'm never going in the woods again.
Yep. Ironically, going in the woods is, yeah, anxiety inducing, but really healing too. Like nature is healing and grounding is really good for you. And sometimes just saying, like, you know what? I'm stronger than the Lyme. If I get bit again, I already have germs of Lyme in my system. It's
Right.
chronically there. It's going to be there forever. So if I get a little bit more, like, F it, like I want to go enjoy my hike, like, and just sort of saying, like, believing in the power of your immune system, even though it's failed you, is a courageous step
Right.
that sometimes has to be worked on with a therapist. I've had that a few times, but just getting outside again can be really helpful depending where someone's at.
So
Um,
really quick, you just said so the immune system has failed the person. Let's say you have a really stealthy, strong immune system, right? You got
mhm.
strong soldiers in there and you get bitten by a tick with Lyme. Is it possible with that strong and robust immune system to not get Lyme, would you think?
Yes. Yeah, it's definitely possible. I mean, I would say I personally have some Lyme disease markers in my body, but I've never had Lyme acutely or chronically. I've been bitten dozens of times being in the Midwest, going on hikes in Wisconsin. I one time I went to this is when I was a doctor, and I went to I was treating a Lyme person that day. I was actually like texting with a Lyme patient, and I went to the beach for sunrise. I walked back, and somewhere along the way, probably in one of the bushes by the beach, I was like finishing my decaf coffee, and at the bottom of my mug was a tick. And I was like, I was drinking a cup of coffee that had a tick in it. I was like, oh, great, this is nice.
Right.
And so, but yes, you can get bit and not develop Lyme disease. That happens all the time.
Okay. So essentially you're almost in a sense a viable host
Yes.
for the
Yeah.
Lyme,
Right.
right? Okay. So my daughter who has Lyme, and I guess it's a past infection, and she's 17. And what I do at home, it's a pretty micromanaged what we do and don't have as far as food goes,
Mm. Yep.
right? And what I bring in, but I can't control her at 17, right? And I'm constantly trying to educate her that there are things that could re-trigger her Lyme. I mean,
Hmm.
that's correct, right? It could
Yep.
be mold, it
Yep.
could be something, another stressor, right? And then new or even potentially different symptoms could show up.
Yep. It's true. But I almost try in the mindset side, I try to get people to not call it their Lyme. Like I try to get them to rebrand it as like CIRS or another diagnosis, which is CIRS, chronic inflammatory response syndrome.
Okay.
A lot of the mold community uses that
Okay.
terminology. But I almost try to get them to say like, "Oh, I'm feeling my digestive system is off more, and my immune or my inflammatory response is activated." Rather than saying like it's the Lyme, because it starts to decriminalize the bug or decriminalize that like one, because there oftentimes is a big fear of ticks or there's a big fear of germs,
Right.
rightfully so. But it starts to shift the blame away from that and shift the blame to being like, oh, it's you don't want to say like my body is malfunctioning, but it's like my body is trying to heal itself. My body is trying to process um, whatever new stress it's been re-exposed to.
Right. So it's sort of a reframe. You're trying to
Yeah,
reframe
trying to reframe it into something that's a little bit less of a
negative,
lifelong sentence. Yeah.
right? A more positive,
Yeah.
embracing a more positive outlook.
Right. Yeah. Or like, oh, you could say like, oh, my Lyme got re-triggered, or you could say like my immune system is triggered again.
Mhm.
And
And then, yeah,
I'm sounding like I need to, or I might want to work with my immune system or my hormones or my gut or my herbal protocol or whatever it is to get back to myself again.
gotcha. So I know we just have a few more minutes. I wanted to, is there anything that you would like to share with the audience where they can find you? Any offerings, any classes, your membership? You want to tell us a little bit more about all of these things?
Yeah. Let me see. They can find me at Dr. Campbell Cares, Dr. Campbell Cares on Instagram. And
Okay.
then the website for the membership is campbellcaremembership.com. We got a couple live seminars coming up for our members. 3 seminars are included in the membership
Okay.
in Chicago. They can email about me or DM me on Instagram or campbellcaremembership.com if they're interested in that. But um, I would also just advise people to consider seeing a Chinese herbalist or an acupuncturist if you have Lyme too, if you have not already. I can find or some sort of hands-on healer. A lot of people will see people testing labs and providing supplements, but finding some sort of hands-on healing, if you have it near you, is very helpful. And I find a lot of Western trained only practitioners will only treat the excess toxicity, inflammation, infection, germ, bad stuff, but not so much like repairing, rebuilding, and building up the deficiencies. And that's where I find the most effective success for my patients.
Okay. And so that's when you would integrate the acupuncture.
Yeah, acupuncture or herbs or other
Chiropractic
things.
care, right? All those things to help boost the immune system.
Yep. Yep. A
Yeah.
lot of people will say like they tried it once. It's like saying you went out to a restaurant and you tried food and so you never ate again. It's like, well, it takes like the gym. It's like going to the gym. You can't just go to the gym like one time and be like, I'm better. I have huge muscles.
Yeah.
But yeah, I could talk about this all day. Like, oh, a quick note too for people who do have Lyme and they're wondering about exercise. Maffetone method, Maffetone. The Maffetone method is a free heart rate protocol you can get online. You can look up Philip Maffetone. He's an old guy who used to train Olympians how not to stress out their hormonal system, their nervous system, and their heart while they were training. So not overtraining or, like you said, doing CrossFit. But he has a heart rate formula that's 180 minus your age, then minus an extra 5-10 points if you're not well. And that's your maximal heart rate while you're exercising. So keeping a lower heart rate while you work out helps chronic Lyme patients quite a bit.
Okay. So we're not doing a lot of that HIIT.
Correct.
Yeah.
Yep.
Yeah. I mean, I don't do a lot of the HIIT in either. I have a spinal fusion and I've seen chiropractic. Well, I didn't find chiropractic care till in my 20s. It just wasn't something you did. And in hindsight, I was 12. I had just gone through puberty and my parents, I had scoliosis and S curve. I can't remember the degrees. I've read studies now that say that, and you maybe have seen them too, that these rods and so forth don't even hold, and they don't have records. So when I called back to find the degrees of the curvature, but the idea was, and it's a Zilke, so they did screws from T11 to L3 in hopes the upper curve would not get worse, basically. And they went into my left side and broke out 2 ribs, those bottom ribs, and went in that way. Anyway, I wish my parents knew about chiropractic care. It just wasn't, I'm 44. It just wasn't something that they were looking into at all, or massage. And I wish if they could go back, we did it here in Louisville, but we also went down to Vanderbilt to get a second opinion, and everybody thought this was what had to happen. And I'm just not convinced. Now, having, being a body worker myself and a fascial stretch therapist and massage therapist, that was the only way. Right. But I've been seeing chiropractic, and I think the body work is so important, even to like down regulate the nervous system so you can relax. Right. I mean,
Yes.
it's just so you have to take an integrative approach, which is, when I say mind, body, and spirit, you just can't leave out one. You just can't.
Just can't.
No, I
Yeah.
mean,
It's like,
you might wanna
it's like
try,
you don't
but
want to. You
don't,
might, but please don't.
right. Yeah. Yeah. Well, thank you so much for joining me this afternoon. It's been great talking to you in person. I get to
Thank
see
you.
on Instagram. I love your videos. I hope others will follow him, Dr. Campbell Cares, right?
Yep.
And check out his website and his membership site. What is it, Doctor? It's still Dr. Campbell Cares. Is that what you?
CampbellCareMembership.com.
Okay, CampbellCareMembership.com. Okay, thank you so much, and have a great afternoon.
Thanks. You too.